Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. All right, George, tell me what's going on with your knee, your foot, the left knee and foot.
Okay, in December of 2017, I had a knee surgery that was very invasive, where they had to remove my ACL ligament.
And this knee?
And this knee, yeah. The reason they had to remove the ACL ligament is in 2010, a surgeon did an ACL reconstruction and put the cadaver in wrong. He drilled the holes in the bone wrong. So 2 MRIs.
2010, you said?
2010, yeah.
Oh, wow.
And I had problems with it ever since. So in 2017, I went to another orthopedic surgeon, the surgeons for the Indianapolis Colts. And they did 2 MRIs, and 2 different radiologists said that the cadaver, the ACL, was in wrong. So they removed it. So since they removed it, I'm walking better. I don't have an ACL, but I've had nerve damage, and my IT band is very tight all the way down. And then the top of my foot, it hurts really bad, and then the bottom of my foot.
So how much pain do you feel there from 0 to 10, and where do you feel it?
I feel it on the top of my foot, all up way up into my ankle, and then through my toes, and it's constant 24 hours a day, like a 5. And there's times when it's an 8. Well, when I was able, about a month after, when I was able to get through the pain in my knee, I could start feeling, the nerve damage from the surgery.
What kind of pain? Sharp, dull, aching, tingling?
Aching in the middle of the night, and aching so bad it will wake me up. And then there's definitely tingling, and then numbness.
Numbness, and all that's most of your pain concentrated on the top of your foot.
The top of my foot, and then inside the ball, inside this area.
In that area.
And I've tried stretching it, rolling it, ceramic wheels.
Oh wow.
Yeah.
Okay, don't do that at home. Yeah.
Like plantar fasciitis tools I've tried to do.
You try that. Yeah. So December, we currently in October 2018, so it's about like 10 months or 11 months. So what type of treatment you had before coming here?
I've had chiropractic, where they said something was out in my hips. Caused my foot pain.
Okay.
So they tried to straighten out my hips. Okay. Then I had massage therapy from numerous different massage therapists on my feet and my ankles. And one said it's because my shins were so tight, and that the IT band was causing that tightness down there. So they would work in it with their fingers and really dig in really hard.
So you had chiropractor, you had massage. What else? You had physical therapy?
Not on the foot. Haven't. Okay. Yeah. They said it would go away after time on its own. So they didn't give me physical therapy on the foot itself. Okay. I had physical therapy on the knee
after the surgery.
Yeah, but that didn't help my foot.
Okay. So can you give me a little bit like what's going on with your knee now? How much pain? What's difficult for you to do?
Okay. So this is counterintuitive, but without the ACL, I'm able to move my knee, and I've been able to ride my bike and jog and run, but very carefully, because I don't have an ACL ligament. Okay. So I've got range of motion, and I don't have much pain in it, but my leg has gone out on me where I was going downhill.
Like gave out, yep.
It gave out, and I fell down one time in the landscaping,
and
I
gotta
tore
be
it all
careful.
up.
Yeah, okay.
Because I don't have an ACL, so I'm dealing with that. But mostly, the IT band that goes up to my hip is what's causing. It's like a rod in my leg, and you can feel it.
And that's since 2017 or since before that you have. Okay.
Yeah.
So you feel tightness in your IT band.
Yeah.
Okay. All right. Any other treatment you had? Anything else we need to know about this?
Just pain pills. I went to a pain clinic.
Okay.
For
so
pain
management. Okay.
That did not work for me.
So I want to know, like, I know you told me you have like a constant pain, like how much, 5 to 6 or something like that?
My foot, like
your foot.
Yeah,
okay.
It's a constant 24 hours a day.
24 hours.
Oh yeah.
I want to do a motion that actually stimulates your pain. To use that for testing. I know
Okay.
you have pain currently, but I want to see that motion so when we do the treatment we can retest it again.
Okay.
So what aggravates your symptoms? Standing, walking.
Standing.
Okay.
But walking. Every time I bend my foot up like this to
Okay.
take another step.
Mhm.
So when I take a step and my foot goes up, I feel it. I feel it right in here.
Okay.
So I
Okay.
take a step here
Uh-huh.
and then right there.
How much from 0 to 10?
It's 6,
Okay.
7,
Okay.
8.
Okay.
and
So
9,
when you do like heel raises.
and I don't because they hurt like right there. I'm on one foot, but if I do one,
Mm-hmm.
yeah, I can do it, but I'm about to grit my teeth.
Okay. How much from 0 to 10?
It goes up to a 9.
Okay. One more time. I want to see how much pain and give me the number.
Okay, so let's just 6
Uh-huh.
and 7,
Okay.
wait,
Don't fall, okay?
8,
Uh-huh.
9, 9 and a
Okay.
half. Yeah.
Okay, don't push it. Okay.
Mhm.
All right. So it's just a few seconds, and you feel that. So we're gonna use that for testing. Okay.
And then when I go downstairs,
Mm-hmm.
anytime there's impact like this, I'm not hitting it, but that tap, tap, tap.
Just
So-
tapping like
So
that.
just tap like that, tap, tap, tap. It's pain. It goes up, shoots up my leg, and it starts going numb. Just tapping,
That tapping.
and I'm barely touching. I'm just tapping.
Oh, okay.
And this
Numbness. How much from 0 to 10?
That goes up to about 7, 8.
So we're gonna use that tapping, and we're gonna use the hair raises to see how you respond to the treatment.
Yeah.
All right.
I'm moving it more.
Mm-hmm.
There's tightness in there, but I'm not feeling the pain. I just
The
feel
pain,
tightness.
what I know you're gonna continue feeling tightness because there's a lot more work to do. What I care now is the constant numbness you used to feel and the pain. That's what I care about.
Maybe a 1 in pain.
Where? Let's drink more water.
More water?
Mm-hmm. And then we're gonna. So how much is now and where?
I drank that water and it got better. How's that possible?
Because when I release the scar tissue and fascia restrictions, that's release toxins and waste product.
And it happened
So-
that fast?
Well, the release is so fast. And if patients do not drink water to flush those quickly, they will be confused that the soreness is from the toxic, not,
I just
From
got
the
better from
release.
drinking that water.
yeah. It's not a magic water, it's just a regular water. But I noticed, like, I had a patient that was really stubborn, not want to drink water after the treatment. I'm like, just make sure you drink water. It's like, I feel soreness, but yeah, it took him 2 days actually.
I don't
And-
feel pain now. I feel pressure, but not as much pressure. It's moving better.
Okay, so that's your foot. Okay, what about your knee?
Oh, the knee doesn't hurt, but I mean, this area here's better.
Mm-hmm.
It used to be I would just touch it and tap it, and it would just go through my knee. But
So any
that's
pain
much
now?
better.
Any pain or it's gone?
Hard to believe. I thought that would hurt.
Yeah, that's good.
I'm pushing really hard on it, and
Yeah.
I may have a 1, 1.5.
That's not bad
I have
actually.
like nothing there.
Uh-huh.
I mean, look how hard I'm pushing.
Yeah.
I probably created about a 2
Mm-hmm.
with.
I don't want you to aggravate it. You might have some inflammation. We're gonna work on the inflammation. There's still some work I need to do here.
I mean, like maybe a 1 right there. So
Okay, so the constant pain, 0 to 10. Foot, like knee and foot.
constant pain.
Yeah.
I don't have any.
Okay, so let's do the other test for the tapping
Okay.
and the hair raises. Because you
Okay.
said your pain was like from 7, the constant pain going to
Okay.
8 and 9
Okay.
with that. So I want to know how does that feel?
Actually, this foot is tighter than that one.
Okay,
That does not hurt.
okay.
I mean, I feel it because it's a tap, but
Mm-hmm.
I would say when I tap it, it's maybe a 1.5.
Not bad, okay.
I don't remember the number.
You
I
were
put
clenching
before.
actually before. I tried to get your whole body
I
before.
felt it.
Yeah.
So this is something I did before, going up
Yes,
on there,
yeah.
and that probably goes up to like right there. Right there is putting me at about a 5.
Where?
Up that high right there. Up, that's extended about as far as I can go.
Five where you feel the pain?
The pain in my big toe and the whole ball of my foot. I'll show you.
Okay.
So when I go up that high, which is high as I can go,
Okay.
I feel it. This whole area right here.
Okay.
That whole area there.
Like
now, let me just try with this foot to see if I get much. You know what? They're about the same. This foot, this leg did not have surgery, and I feel it there too.
That's a plantar fasciitis for both of them. Okay.
That's the same pain I have, yeah. But I don't have it the other.
Well, we're not working on the right. Let's focus on the left, the side we're working on now. So you feel it like 5 now, because I'm gonna do more work and we'll come back.
As far as I can go.
Yeah.
It was a 9 to 10.
Well, I'm getting your face now. You're not really doing this.
My teeth off. Yeah.
Yep. So let's lie on your back.
Okay.
The same position. Okay.
So
it's right here in the ball.
So yeah, I don't know if I can do it from here, but when I go all the way like that, yeah, it was this.
Okay.
This whole area.
All right.
Yeah.
But here, this is okay. The one we worked on.
It just tingles a little bit. No,
Okay.
I don't know if you go.
Let me know
I don't
if
know
it's
if
too
you
much.
could go slower. If I could get it more. It's so tender.
And that area.
Yeah, it's really tender.
Okay. Let's see if you can tolerate the tools.
I hope so.
Okay. What about now?
I'm okay with that.
Okay. I'm gonna increase it gradually.
Okay,
Give me feedback.
That'll probably help if you do it gradual.
What about
I'm
now?
okay.
Okay.
I think what was bothering it was the fast motion going across it.
Yeah.
That's what was causing it to. I'm okay with that motion.
Okay. That's good.
Yeah, that doesn't hurt.
Okay, that's good. That's real tight. So it's the whole pad.
Mhm.
Yeah. Okay.
Yeah.
Let me do this and tell me if that's. Is it painful? It's okay.
Yeah, I'm good.
Mm-hmm.
Pretty tight in there.
Mm-hmm.
Feel that.
Mm-hmm. How's that?
Yeah. I mean, it's on the edge of being painful, but it's pressure.
Okay.
That in there, it hurts in there pretty good.
Sure. Okay. Definitely has some inflammation there. That's. Do you feel pain with this joint here? Yes. No.
No?
Because there's no inflammation.
Oh.
That's the same pressure I'm applying here.
Oh, really?
Yeah. So that's another sign.
So there's inflammation in the feet then?
You can get an inflammation anywhere when the body is not healing. You remember the healing cycle? The
Yeah.
body has to go through inflammation, proliferation, maturation.
Yes.
And for the viewer, if you want to learn more about the healing cycle, you can check other videos we have. What is ASTR, or the normal healing cycle? I will have a link in the bottom. So the body has to go through 3 stages: inflammation, proliferation, maturation, in order to heal.
Mm-hmm.
So with the ASTR tools, I work on the proliferation stage.
Okay.
If patient is not tolerating the tools, that's they usually have inflammation and proliferation, their body going back and forth.
Mm.
So I use ASTR inflammation protocol for those patients based on how severe is the inflammation.
Mm.
Because if we don't work on both ends, you probably will not be able to get to maturation, because the body's stuck in either or going back and forth. Is that too much?
Oh, I feel much difference there.
0 to 10?
Without my body weight on it,
Mhm.
I feel 0.
Okay.
0 pain, about a 3, 4, like tightness.
Tightness, we're going to work on it more,
Right.
because you have
Yeah.
really
But 0 pain.
severe tightness.
So do you need me to put my body weight on it to see what it does?
Yeah, let's just stand up, you know. The tapping, how is that?
It feels like a 1 tapping, tapping.
That's not bad.
No. Yeah.
Okay.
Or 0. I don't know. It just.
Mm-hmm.
Okay, so I'll use my body weight
Mhm.
on there like I did before.
Mm-hmm. How much is now?
Maybe 4,
Mm-hmm.
3, 4. In here.
Oh, your big toe?
Yeah.
Okay. Not in the area I worked on. I did not work on the big toe yet.
Oh, yeah, that area. It's, I feel it in here.
Uh-huh.
Some pain.
Uh-huh.
But I'm pushing as hard as I can,
0
too.
to 10?
Maybe 3, 4 at the most.
Let's get to the same position.
So actually, I was trying to cause pain for a reference point,
Yeah.
but I don't walk like that.
I hope not.
No.
Okay.
So yeah, the big toe. You know, I was feeling something in there, and then that.
Mm-hmm. I'm not work on that, so I'm gonna do more work on it.
That big toe. I used to get gout in it.
Oh yeah. Mm-hmm.
That's probably as much as I can handle.
Okay, okay. So you see, I know there's some inflammation here.
Yeah.
That's why I'm able to do some work, but not too much.
Can't get too deep.
Not too
I'm
deep.
sorry.
So no, that's fine. You know, well, at least we know. It's different than your IT band. When we worked on it, things was like moving fast because
Wow.
there was not a lot of inflammation there.
Yeah.
You know, that's fine. At least we know where is the inflammation, so we're gonna focus when we work on the inflammation, where to work on. Okay. Sorry. How about that?
Okay.
Okay, how about this?
That's okay.
Okay, how about this?
Yep.
Mm-hmm. We'll have you drink more water, okay?
Okay.
Why this taking time? Because you had several injuries. You know,
I feel bad
you have a lot going on. I'm not like basically what we're working on. We worked on IT band. We worked on that trauma you had it there, and the injury and chin splint, and we're working on plantar fasciitis. So you are like 5 patients in one.
And I'm like,
And
that was
inflammation.
That was my 4th knee surgery.
Yeah. So you got your money worth here.
Yeah. I'll tell you.
Yeah. Is that too much?
No?
Okay. All right.
Okay.
As long as you do it, you feel better quickly. Let's stand up and we'll do the same thing again. Tapping.
Yeah, that's improved. I'm actually, before I was just touching it, now I'm
Yeah.
actually pushing it down.
Yeah, beautiful. Looks
Okay.
good. Yeah. How's that?
There's some pain on the right side of my,
0 to
the
10.
outside of the toe, but I'm now pushing that.
0 to 10.
Like a 2.
Not bad, actually, not bad. I'm not expecting it gonna be to 0 because you
Well,
have
I
some
know, that's
inflammation.
the
But
first
2 is
treatment.
not bad, actually. I'm happy with that.
It's been that way for 20 plus years.
Yeah.
So
20 plus years, how much pain you had it there before we start working on it?
oh, it was 8, 9. I mean, when I get off work, I
Yeah.
didn't
8, 9,
didn't want to do
yeah.
anything. I just get through the work day, and
Yeah.
if my feet don't hurt, I would want to keep doing things.
Yeah. All right, that's good.
Yeah.
How does that feel? You're really doing a lot now.
I know, and I'm
Are you trying to
barefooted.
show off here?
Yeah, I'm showing off because
Beautiful,
it's working
good.
so much better. So yeah.
Yeah, that's beautiful.
Thank
you can
you
have
very
a seat
much.
here. So, what do you think about ASTR treatment? So,
I'm a believer. I don't
Yeah.
think I'll let anyone else touch me
yeah,
other than this ASTR treatment. So
Yeah.
I've tried everything else.
yeah, awesome.
Yeah, that doesn't hurt near as bad as those needles.
The acupuncture you had?
Yeah,
Yeah,
I've done
yeah.
that too. So
Yeah, awesome. Thank
Yes,
you.
thank you.
Yeah, awesome.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.